Local doctors taking a new approach to pain control.
Your pain never gets bad enough to require those strong opiate narcotics.
Helping patients avoid the risk of addiction.
I'm thoroughly impressed that I didn't have to touch one opiate.
The opioid epidemic has a lot of patients concerned about taking the powerful drugs after surgery. Are they really necessary?
A new local study is testing a different way to control post-surgery pain. Dr. Frank McGeorge is here to explain, Doc.
Exactly, Devin and Kimberly. You know, instead of giving patients potentially addictive drugs and telling them to just take them as needed, this new approach is more aggressive about preventing pain. The goal? Reduce the need for opioids right from the start.
Let's check your motion out. So you start with your hands out in front, lift them all the way up as high as you can go. Great.
It's a move that was impossible for Joshua Cox just 4 months ago.
The rotator cuff was torn. It was torn right in half.
The 40-year-old dad from Rochester Hills also had arthritis in his shoulder.
I'm a union ironworker, so we do the steel structures of buildings, bridges, skyscrapers. It's just wear and tear over the years between the manual labor that I do and then lots of softball and baseball over the years.
After 6 years of suffering,
and it got to the point to where I just couldn't take the constant pain in my shoulder anymore.
One of the reasons he put off surgery for so long was concern about needing to take opioid painkillers.
I've had family members in the past have issues with them, so it was scary. I didn't want to have to take pain medication.
We want to get you moving.
Surgeons Rob Keller and Nicholas Frisch of Ascension Crittenden Hospital say it's a common concern.
Patients are coming in fairly educated on the opioid crisis, and so a lot are coming in saying, how can I find ways to not take a ton of opioids? They're scared of becoming addicted.
Keller says there is a clear problem with the standard approach.
You get some narcotics after a surgery, and whenever you have enough pain, you start taking them. So if people are scared to take these opioids, they wait. And sometimes they wait too long, their pain gets out of control, and then they have to take too many.
Their study addresses that issue by testing a proactive protocol,
where you take non-opioid medications scheduled, so your pain never gets bad enough to require those strong opiate narcotics.
The medications are chosen to target different pathways of pain.
So there's Tylenol, everyone knows that. There's an anti-inflammatory. There's Tramadol, which is a small pain medicine, and then there's gabapentin, which is a nerve medication.
Patients receive their medications in advance and start taking them before the surgery even begins. It's been an adjustment for everyone.
Most people are actually just used to the old protocols. They're used to getting Vicodin or Norco or oxycodone. And so when you tell them, you know, you're going to have maybe 15 to 30 pills of pain medicine, at first they kind of look at you like you're crazy.
But so far, the results are overwhelmingly positive.
We get very few calls to refill any pain medication, which is completely different from what it used to be.
We're about 30 to 40 patients into the study. We're looking at things like ACL reconstructions, rotator cuff repairs, and our average opioid intake is about a half a pill. So normally those surgeries, you're looking at more 30, 40, 50 pills. And right now we're able to get it down to not even a pill for most patients.
That includes Cox.
I had absolutely no pain. I'm thoroughly impressed that I didn't have to touch one opiate. I mean, I was given a prescription of Oxycontins, and I didn't even take one of them. I had less pain after the surgery than before the surgery. It was pretty amazing.
He hopes the study will encourage other doctors to reconsider their approach to post-surgery pain.
I think everybody should be trying to get on board with this, and I think it'll help a lot of people out. If it was going to be like this, I wouldn't have put it off for so long.
Now, this is currently a pilot study at Ascension Crittenden Hospital, but from here, the doctors hope to take it to a multi-center study, and they've already had interest from surgeons in other states. And just as a measure of how much they believe in it, they are now using it with all of their patients, not just the ones that qualify for the study.
Yeah, really important, because as much as we've talked about people being overprescribed things, you get people with legitimate pain issues who are afraid to treat it.
That's exactly it, and it's keeping some people from having necessary surgeries and procedures because they don't want to fall victim to pain problems.
Sure. All right, Doc.